My name is Jamie. I am at Child Care Answers, and today we are here for our workshop about Medicaid, just to learn everything we can from covering kids and families and Indiana's managed care entities. So during the session, we will learn the ins and outs of Medicaid, healthcare coverage, with some time to ask some questions as well. Great. Well, let's get started today. Covering Kids and Families is going to start by sharing a little bit about resources and just getting us started on the topic. Thank you so much.
All right. Good afternoon, everyone. I am Alicia Collicott. I am the Outreach Coordinator for Covering Kids and Families of Health and Hospital Corporation. Of course, as most of you all may know, some of you all may not, we are a program here that is housed at Health and Hospital. Some people also know us as Marion County Public Health Department. What we do here, we service our clients as far as helping them get signed up for health insurance programs. We answer any questions, or if we can't get it done, then we reach out to various community partners that we partner with to make sure that they get their services or their needs met. I am going to share a little presentation. That's a little short, but it'll just show you all a little bit about our program. I'm going to put it in slideshow. Okay, so I'm just going to go through the slides. Once again, Covering Kids and Families, a Health and Hospital Corporation. Who is CKF of HHC? We are an outreach program designed to assist families with health enrollment. Health and Hospital Corporation is our parent organization. Also, Eskenazi is our sister company. So that's what makes up Health and Hospital Corporation, the health department side and the hospital side, Eskenazi. We're part of a statewide network of agencies. We also do have a statewide Covering Kids and Families of Indiana as well. And it covers the whole entire state of Indiana. We have different CKF coalitions, different offices in different counties throughout the state. Here at HHC, we are the largest program of CKF Indiana because Marion County is the largest here in the state of Indiana. CKF of HHC, we cover 7 surrounding counties along with central Indiana. We partner with more than 100 agencies. Those agencies consist of clinics, schools, doctors' offices. We go to homeless shelters, libraries. We go to events where we're outside signing up people. If we have to go to your job, wherever is convenient for the client is where we're going to meet the client at to get the enrollment done. If we cannot meet the client face-to-face, then we do accept referrals, and then we will make it convenient for the client to get their enrollment completed. Once again, like I said, we do offer home visits, work visits to serve the clients. Our mission here at Covering Kids and Families is to promote and facilitate healthcare coverage through building coalitions that enroll, educate, and support Hoosiers. Advocating for strong and inclusive public policies. We currently have what is called a subcommittee here for CKF. That is a monthly meeting that we hold with all of our partners. We get on there to discuss focus areas, school outreach, enrollment awareness is one of the areas. And what we try to do is reach out to the community to see how we can promote and educate people about health insurance through those committees. We also have what is called a coalition meeting here for Covering Kids and Families. We have that biannual. We always have it twice a year. It's usually held in March and in September. Our next meeting will be coming up September the 21st of this year. That coalition is a little bit larger. It has more of our community partners that gather with us that are not a part of the subcommittee. We get together, we have a speaker, someone that can come and share additional resources that we may not know of. And then the community partners can take that back and help serve their clients. Covering Kids and Families goals and objectives. Our objective is to try to reach at least 10,000 people each year. Every year we try to hit that goal as far as servicing the clients, any events or anything that we go to. Some of our community partners may ask for us to come to their events. Just example, this presentation is also reaching out to people as well. We try to attend at least 150 events per year as well. Just name some of the programs that we help enroll or assist with here at Covering Kids and Families. One of them is Hoosier Health Wives. It's a very well-known program for pregnant women or children 0 years of 18 years of age. Once you're 19, then you kind of convert over to the Healthy Indiana plan. It used to also be known as HIP 2.0 as well. We also do Healthy Indiana plan, which is HIP. That is for adult Hoosiers from 19 years age to 64 years of age. There are, excuse me, there are different plans with Healthy Indiana plan. As far as there is, I think, a category for pregnant women under HIP as well. There's HIP Basic and there's HIP Plus. The HIP Plus also offers more coverage than the HIP Basic. HIP Basic is just your general medical insurance, but HIP Plus, you can sometimes get dental and vision added on with that. To name a couple of other programs that we assist with, we have an in-house program housed at our Eskenazi Hospital, Health Advantage. This program is not insurance, but it is a cost assistance program that can help our clients still get their medical needs met, but at a lower cost than being on actual health insurance coverage. Usually with this program, we sign up anyone that may not be a U.S. citizen, or they may be trying to become a citizen at that time and may not be eligible for Medicaid at the moment. So we try to get them signed up on this program. That way they can still go see a primary care doctor or a specialty doctor at Eskenazi Hospital. So you can only use Eskenazi and their clinics that are around the city. You could not go to like an IU Health Hospital or any other network. You have to stay within Eskenazi. We also do the Marketplace or Affordable Care Act. That program is a once a year thing, usually opens up on November the 1st, and it usually goes to about the beginning of the year. Then clients can come in whenever they want. They can schedule an appointment with us. They can walk into our office location and do this application right then and there. If they are approved on the system, then we can help that client shop through different plans, whatever is available. And we can explain to them costs like co-insurance, deductibles, out-of-pocket costs, how much their prescriptions may be when they go to pick them up to the pharmacy. And then it's up to the client to choose what insurance company they want to be covered under. Where can you find Covering Kids and Families? We are currently located at 2951 East 38th Street. We are in the lower level of the building. And once you come, we do have like a doorbell that you can ring that'll let us know that a client's there. Like I said, once again, you can make an appointment or you can call. It's totally up to the client. But then you just come to this address. We're open Monday through Friday, 8 a.m. to 5 p.m. We are closed, of course, every major holiday. You also can reach us on our website. We have 2 web pages, www.hhcorp.org, which is our health and hospital website, or you can reach us at our CKF Indiana, www.ckfindiana.org website. We do have a 800 number, this 888 number, 9754-CKF. When you call this number, it reaches every single office in the state of Indiana. So what you have to do is you have to listen to the prompts. If it tells you to push number 1, you may get Marion County. So if you press number 1, then it'll ring to our office. If you press number 2, it'll ring to whatever office that is located in Indiana. And then you can speak to an actual live person. If you call here from Marion County, I would be the one that would get that phone call. I would speak to you, assess you. If you can be signed up that day, we'll have our navigator sign you up that day. If not, then we'll just get further information and contact you back. Here's a list of some of the surrounding counties that we serve. In addition to Marion County, Morgan, Johnson, Shelby, Hendricks, Hamilton, Boone, and Hancock. So once again, like I said, we are the largest coalition for CKF Indiana and for Health and Hospital Corporation. CKF staff, we partner with the local school districts, neighborhood organizations, churches, and homeless shelters. How to refer a client to us. Once again, the referral line. You can do the website. You can fax us. So if you want to fill out something, or if you already have a client, the client's information already ready, you can fax it over confidential. We'll get it, we'll contact you just to make sure that we know why we're calling the client and what we're calling the client for, and what the client's needs may be before we call to assess. Or you simply can just make a phone call to myself. The first number is mine, 317-221-2464. Or you can call our team leader, Akila Shepard, 317-221-2041. If you would like to partner with CKF of HHC, we are always welcoming partners. I am the coordinator, Alicia Calicott. This is my telephone number, my email, or this is the website that you can contact me through to get connected with Covering Kids and Families. And that is all I have.
Thank you so much for sharing. It's always important to know how to best find those resources. Yeah, I really appreciate it.
So I'm Jeff, Jeffrey Galbraith with CareSource. I'm just going to start off today. I'll tell you a little bit about CareSource and the things that we do differently, because all four of the MCEs, we have the same health coverage. We'll have some of the same programs. So I'm just going to take a moment to talk about the different things that CareSource does. So CareSource, we are a MCE, managed care entity within the state of Indiana. Our tagline, covered with kindness, we do things differently. And that's mainly because we are a nonprofit. So we're a nonprofit. We've been around for almost 30 years now. Currently serving, we're actually over 2 million members within Indiana, Georgia, Kentucky, Ohio, West Virginia, and we just got a contract for Mississippi this past week. Our main focus is the Medicaid, so HIP, Hoosier Healthwise population, and then we also do have Marketplace across the state. Like the other four MCEs, our HIP and Hoosier Healthwise is in all 92 counties. Same with our marketplaces, we have been across the state this past year. So one of the things that we have our enhanced benefits, transportation. All four of the MCEs offer transportation in some manner. Ours is unlimited transportation for your rides to the doctor and the pharmacy. Obviously, that's something that you need to set up beforehand, but we do have unlimited transportation, also rides for WIC for our pregnant mothers. We also have a banking service. We have express banking with Fifth Third. It's kind of a no frills checking account, but it has no monthly service fees, no balance requirements, no overdraft fees, just a debit card, no checks for it. But if you have somebody that's trying to get back on their feet financially, this is a bank account that they can get. And then we also have our CareSource mobile app. Access your member ID card for people that lose those cards or lose their wallet or just have a problem carrying them with them. You can do the mobile app, have your ID card right there, look up your doctors, just basic services right there. That's kind of the basics. Now we go into items like the social determinants of health. And this is really what sets us apart, I feel like, from our competition. We have teams working on battling the social determinants of health, and we've actually been giving grants around the state, and we have a team working right now on housing instability. We have our team working on food instability. So we're attacking food deserts around the state, and we're making that a priority as the years go on. We also have our economic stability education. All these go in with our actual next group, which is part of our, we call them Job Connector, our life services. And this slide is actually outdated. Our numbers are higher now. But if you look at it, what I really want to bring attention to is the employee partners. It's 192 on this slide. We have well over 100 or 200 now. I'm not sure what the exact number is, but the 71% member retention. Now we have a team, our Job Connect has actually paired with employers from around the state. They work really hard to get our members educational services, get them jobs and well-paying jobs. And you'll see there the 71%, that's members who have retained employment over 90 days. So that's really important. They're getting their financial stability back, and that will bring more stability to their life and to their health by taking out one of those social determinants of health. The way the team does it is through our life services. Our life services have certified life coaches that meet one-on-one with people. Basically, they'll go in, assess where the person's at, and figure out how to stabilize them, and then find their plan or where they want to be. Those life coaches meet with them, and they will help with educational assistance, job skills training, even employment. The soft skills are something that's really neat. Because we partner with those employers from around the state, we have the ability to be who you know. It's always not always what you know, it's who you know. We're the who you know. And we've had members that have gone in and had issues with the interview service or completing the interview. And our life coaches are able to go back, sit down, and figure out what went wrong in that interview, improve soft skills, and help overall achieve employment success. And you'll see our goal is not the minimum wage, $12 to $13. Our goal is that starting wage of $20. So we want people to have a living wage and be able to get back on their feet. One of the other populations that we have really focused on is the reentry population. And so with that, we've done a huge push. Dr. Wright and the team that she's created have gone into 15 IDOC facilities. I personally have presented within Edinburgh and Pendleton. It's really great because we actually have a team working on that. As they come back out into the population, we are presenting them, getting them on CareSource. Then if they have some type of managed disease like diabetes, heart conditions, blood pressure, whatever it may be, we have a team, our case management, our Care for You team, working with them, making sure that they're getting the medical treatment they need. We also have the housing, food assistance, everything to keep that recidivism rate lower by taking away all that instability that they may be coming to as they get released. That assures the higher quality of care, and like I said, gives them a better life. And so that is the way we facilitate long-term and well-being of our membership in that population. Just real quick, all 4 of the MCEs have a Babies First rewards program. That rewards program, for us, mothers can earn $200 during their pregnancy, going to their well visits, going to the checkups, and then once the baby's born, doing lead screening, just kind of all those things that moms are doing anyway. But for all 4 of the MCs, the children age out of it. We've actually created a Kids First. So it's 16 months, the kids move into this, and now the parents can still earn $50 a year every year for just doing well visits, flu shots, dental checkups, things like that. Then we have the My Health Rewards for adults. Once again, you can earn rewards just for doing your dental checkups, doing cholesterol screenings, all those things that you do at your annual checkup. And then for our higher risk population, we do have the expanded rewards, which that's up to $300 a year. And that's for people that are going to be facing diabetes, HIV, AIDS, whatever it may be. But if they're more of a high risk and they have more kind of health maintenance that they need to do, this is a program that can benefit them. And then 2 more things. We have our Rides for Food. This was a program we started during COVID, and we decided to keep it permanent. So now our members can actually call in and they can get rides to food banks, food pantries, food clinics, and that Kroger, Walmart, Meijer grocery pickup. They can arrange for a ride so they can get back to that and get food. So that's helping with the food instability. And also our last program that I want to focus on is our driver's license reinstatement. This is kind of a big one because it gives people their independence back. It gives people the ability to get a better job. So we have a team that works, we'll do a financial support of up to $500 to help people reinstate their driver's license. And then we also have legal referrals and everything else. So those are the programs that I feel like set CareSource apart. And I will just kick it back to you guys. So thank you very much for your time.
Thank you so much. I really appreciate it. A lot of great information.
My name is Lucia. I'm one of the member connection reps with MHS. I'm fairly new here with MHS. I joined January. Just a very brief background. I had been a Spanish medical interpreter for Ascension and Eskenazi for about 10 years. So I'm pretty familiar with our community or in our in need population, and I just wanted to get a little closer to that community. We're kind of limited being interpreters with how we could help, and so I very much enjoy being with MHS. Okay. So I'm pretty sure, you guys are familiar with MHS, but we have been around for more than 25 years. We're one of the 4 providers for Medicaid. I won't go too much into detail over our elevator pitch. I'm sure you guys have heard it. So what I did in this presentation is going to be very brief, but like our rewards and resources and tools that I think have helped our members the most, and have kind of motivate them to continue with their health and just kind of be on top of it. One of them, of course, I'm sure a lot of the other providers have them, but it's the rewards, My Health Pays rewards. So right off the bat, within the first 30 days, they can get like, $30 for just completing a health needs screening. But we also, like to reward for just their annual dental, that's 20. Not their annual WellCare visits, that's another 20. So we definitely like to reward our members for that. And like I mentioned, I could not go out without saying without mentioning our language assistance. We have language assistance available 24/7, 7 days a week, more than 150 languages. We also have the ability for our sign language members to get their materials in, I believe it's called the Embreat. So we have that capacity as well. We have the transportation program. So what I like about our transportation program, a lot of other programs do offer it, but we're kind of, this is kind of at our discreet as to, if we see a member that is really needing to go to the food pantry, really needing to go to their, an outside provider appointment, like something that, they're just struggling with, but it's also meeting their health needs, we'll go ahead and schedule transportation for them. So it's not necessarily just for doctors and pharmacy and dental. So we can, MHS has kind of left this at our discreet. If we see the patient or our members needing transportation to meet their health needs, we'll go ahead and schedule them for this service. And then of course you have us, our MemberConnections team. So we're pretty much kind of like your all for one to go to rep. So we are kind of like the midpoint of connecting our members to our care manager program, to those resources that they really need, a food pantry. Maybe they're struggling, getting a job. We hear about job fairs. So we're just, we're your one-stop shop. Another cool thing about MHS is sorry, I don't know if you guys can see there, the Ombudsman Program. And so this program it's really for those members that are struggling, whether it's health problems or they're having issues with their provider. For some reason, they're not going to their scheduled appointments. So once we can get these members, we'll reach out, get them onto this program, kind of figure out what's going on, what kind of service can facilitate, us resolving this problem with them. But this is more of a neutral part. So it's kind of just helps, the members really meet their needs. Within our programs, we have specialized health programs. It's just been all around, to make sure we're getting our members that have those high risk complications, whether it's through diabetes or asthma. We have a lot of services for special needs kids. We have an actual unit, a unit that has that's children with special needs, and this is through our care management program. Another really cool thing that we can offer our members is a cell phone, a reliable cell phone program. They get 250 free monthly minutes, but anytime they make, anytime there's a call or text, that does not count against their 250 minutes. If it's made through, I'm sorry, if it's made like an MHS employee that calls out to them, then they are not charged for that minute or for those minutes. So that's a really good program. They do have to be on our care management program. But even then, if they graduate or or they no longer qualify, they get to keep the phone. So that's still really nice. And then something that we do every 3 months, we hold these member advisory council meetings, or we call them MAC meeting. This is an opportunity for members in the territory that we select. We usually go off of zip codes, but we get to have like these one-on-one meetings where we present to our members about their resources and benefits. And then we also, we provide lunch for them, but most importantly, it's an opportunity for them to approach us about any kind of issues that they've had. If there's a problem with their provider, if they're not able to select a provider. So it's an opportunity for the members to really be one-on-one with us. And of course, we have our 24/7 nurse line. Another cool event that we hold are baby showers. It's educational, along with we try to imitate an actual baby shower for our pregnant members. We do, it's that we provide the food, prizes, and games. We just had one of our members that did a baby shower in a box, which is a virtual baby shower. And one of the lucky mamas won a car seat, and then we actually delivered really nice diaper bags with receiving blankets, pacifier. So really nice giveaways for the mom. So I thought that was pretty cool. Alongside with those baby showers, we host healthy celebrations. And these are geared more towards those non-compliant or in need of service MHS members. So we partner up with providers that we try to search those clinics that have had a very high non-compliant no-show rate, and try to get those members in and complete their services or their screening. And that's pretty much, that's a MHS in a nutshell. We have so much more, but I think those are, for me, I thought those were the most services that have really helped our members. Like I said, my name is Lucia, and you guys can reach out to me at my cell phone. I have it on me all the time. Any questions, feel free to reach out.
Thank you so much, Lucia. That was a lot of great information. We've attended a couple baby showers and just a wonderful event.
My name is Megan Henderson. I am with Anthem Medicaid. We have the HIP, the Hoosier HealthWise, and the Hoosier Care Connect plans. Like Alicia said earlier, that there is the basic and the plus plans for HIP. And so with the plus, it comes with the dental and vision, which is the big difference for that plan itself. For most of the benefits, these are our, these are our Healthy Indiana Plan Quick Start Guides. So we do a lot of like passing these out to community partners, agencies, organizations, members. It basically just has a bunch of the main information packed into a smaller envelope or smaller packet than what you would get in like the mail and the big member handbooks and all that kind of stuff. So it goes over a little bit of, the transportation that a lot of folks have talked about, the numbers, they want you to call 2 days in advance to set up the rides. You can do your to and from rides when you call in, just keep your confirmation number. That way you have it when, if there was something that was to go wrong that we needed to take a look at, or try to help fix issues of, being late or not showing up, those types of things. But you can stop at the pharmacy on the way home from your doctor's appointment. You can go to WIC appointments. Things like that would be covered under the transportation. The we talked, well, a lot of people talked about a little bit of the value added benefits that are offered through each managed care. And a lot of them are, kind of the same. A lot of them are a little bit different. It just really depends on what that individual sees as best for their healthcare needs, which is, how they would determine which MCE to go with. So we do kind of one of my favorites is the Boys and Girls Club. So Boys and Girls Club, this is for the Hoosier Care Connect and the Hoosier Healthwise members, but you get a free year's membership to the Boys and Girls Club. And when I was growing up, I loved the Boys and Girls Club. I went there, I played basketball, I played all the things. But this is just, a way for, kids that may be heading home and nobody's there, or, a way to get your homework. You can get help with that. You can enroll in all the programs, education, health and wellness. The ages are 5 to 18 now. And so and honestly, a lot of value added benefits, sometimes they're a little tedious in trying to get them together and get everything going. This would be, you just call, you let them know you're a member, they send us the information, and you're good for that entire year. So this is one that I really enjoy. I think it's a great opportunity for younger kids to get involved with, and be able to get some assistance and stuff like that with homework or play sports or whatever the case may be. Since I'm on the value added benefits as well, we've already talked about the rides, the Boys and Girls Club. There's a ton of other value added benefits. The tutoring for the foster children, that's one that is really helpful. I think that being able to set that up and being able to assist with certain foster care needs and things like that, such as the duffel bag as well, so that they, can go into wherever they're going into with belongings. And in that backpack, there's books, there's pajamas, there is toiletries, just things like that would, stuffed animals, make you feel more comfortable, and things that are particularly yours. So that's those two things. Assisting with the foster care is something that is also one of the value added benefits that I really enjoy. For the other, we do some stuff with Goodwill for hiring, job placement, stuff like that. It's not particularly linked to reentry itself. You can have a criminal past, it doesn't matter. So either way, you can get connected through our partnership with Goodwill and get set up through whatever opportunities they may have. Along with Dress for Success, it is for folks who are either going to be getting a work from home job or in the office job. They go and they actually get to, it's like a 2-hour appointment. They get a whole wardrobe of clothing to wear to either interviews or work or whatever the case may be. And they can also support computers and things like that. So that's another great program. The same thing with incentives. Your wellness screenings, your things like that, you get money yearly for taking care of yourself and doing the preventative things that you need to do. And you can spend those on, anything but reasonably not tobacco or alcohol or anything like that. But if you needed something for your home, or if you needed something in general, those things you could spend it on. This is mainly if any community partners are going to watch this. We have also a kiosk program. And if you think of kiosk, it's not that giant big thing that I thought. It is honestly just an iPad with a gooseneck kind of like portal type thing. And what it is you don't have to be an Anthem member necessarily, but if a provider or an organization is meeting with folks and they're having trouble getting places, there's the telehealth option on it. There's the language line on it. There's the Sydney Health app. There is the findhelp.org, which I still know as Aunt Bertha. I know it changed, but all of those things are right there and on it. So if those folks are meeting with organizations and people, case management, so whatever the case may be, that would be there for an option for them to use, so that they didn't have to try to figure out, well, how do I get there? How do I do, all those things. One more thing I want to mention with the transportation is if a family member or you drive yourself, you can register with the transportation service and you get reimbursed mileage. So you have to register yourself and you do it through them, they set it all up, and then you would get reimbursed for the mileage for driving to and from, or like I said, if a family member's doing it. So that's just another incentive if you have somebody that's able to take you, and go that route. Other than that, I mean, the same deal. We have case managers. They're of all different types. They're nurse case managers, social work case managers, and it is part of all plans. So with that being said, I'm trying not to take up all the time. I know we all got a lot to say, but I'm going to go ahead and stop with that. So that way Rachel has plenty of time.
No worries. Thank you so much for the information.
This is our Beyond the Benefits flyer that lists all our special programs and things that we offer for our members. And again, a lot of the things that we offer is the same as the other MCEs. And also our slogan is the health plan that pays you back. So I really like to educate on our rewards program because wildly enough, not a lot of people know about their rewards program and they just have points building. So we do have a rewards program like the other MCEs where our members earn points as they complete healthy behaviors. So going to the doctor, getting dental checkups, going to the gym, things like that, they earn points. And with those points, they can redeem them for gift cards. And what sets us apart from the other MCEs is we have our rewards program, members have the choice to choose the actual gift card to a specific place. So we have Target, Kohl's, Kroger's, iTunes, AMC movie passes that they could utilize their points to redeem for. I really like to encourage and make sure everyone that we talk to knows about that program, because I like to say that's free money for our members that's waiting for them that they can utilize that'll help them with an issue, social determinant issue that they may be having. If they need money for groceries or things like that, that's a gift card that they could be utilizing. We also have our Save Wise program, which is a discount program that we offer for our members, where they can receive find discounts on food, diapers, car maintenance, just different everyday things that everyone does, entertainment, that they'll be able to find discounts that'll help them towards costs. Those activities. We also, Megan mentioned the help, Find Help, which we call ours Help Link, which is powered by, formerly known as Aunt Bertha, where our care managers, also all our staff and also our members have access to utilize to find resources, finding food pantry or help finding transportation services or help just with those social determinants of health type things. They're able to utilize that platform to find the help that they need. And as well, our care managers also, of course, walk with them through that process and help get them connected to the services that they need. We also have our MD Wise mobile app, where I like to encourage that as well, because members can utilize their phone while they're at the doctor's office, pull up if they never got their ID card or lost their ID card, they'll be able to utilize that member app to pull up all the information that the provider's office is going to need. We have our Get Help Quitting, which is our quit program, where members, if they complete the program with our rewards program, they are earning points for just when they stop smoking, and then when they complete another year, they're smoke free, they earn another additional point. So that's like $200 or so that they're earning just for bettering their health. We also, of course, like the other MCEs, have disease management. So we have case managers, care managers that are available to help, again, coordinate those services that our members need, help get those members connected to the providers and specialists that they need to see. We also, again, also like the other MCEs, provide free rides for our members. The rides are for the Hoosier HealthWise members package A and Healthy Indiana State Plan members, plus or basic. They are offered free rides to and from their doctor visits or dental visits. And also if a member presents that they are in need of transportation to the grocery store, transportation to a support group, we're also able to cover that transportation for them to make sure they're getting to the services that they're needing. We have a free phone program. So if our members are in need of a phone, don't have a phone, they are able to access a free phone through our phone program. And they can also, if they already have a smartphone, they can utilize the phone they already have, or if they need a new one, they'll be able to obtain a new one as well. And just like the other MCEs, their calls to customer service do not go against their monthly minutes. So anytime they need to call customer service, they don't have to worry about losing minutes because they have no more minutes to utilize. But we also have help with weight control with our WeightWise program, which is we provide tools on our website members can utilize and access to help them on their weight loss journey. And I'm trying to make sure I didn't forget anything. Online prescription refills, if they would rather, instead of having to call, they can just have their prescriptions refilled online with their pharmacy that they go to, which is for us, Walgreens. And then I think that's pretty much our full benefits that we offer our members. We are working on other benefits and services to roll out to our members. So I'll definitely share that information once we have it all finalized and complete. But that is my presentation for now.
Great. Thank you so much, Rachel. It's been such an honor to hear from you all and just to learn about what's going on in terms of healthcare within the community. I personally have a question that maybe some families will resonate with. So I heard a couple of you mention Find Help, Aunt Bertha. Is that your recommendation for any family who is just trying to find healthcare? Would you recommend starting there, or do you have a good starting point for these families? What would be your recommendation?
I would say, especially if they're trying, and sorry if I jumped over anyone, I would say definitely call their health plan. So if they're MDWise member, Anthem, I would say start there first. But if they're, especially if it's coming to just finding a doctor or finding a specialist, it'll be better to utilize customer service in their health plan to help with that. If they're just looking for community services that are available, like just the local food pantry that they need to get to, then I would say definitely utilize the help link, or sorry, Find Help site on their own. But of course, sorry, Jeff.
Sorry. I was gonna say, if you're in a situation where you don't have health insurance or you're looking to find that, CKF. CKF is the best option first. Like Rachel was saying, and Find Help is everything else. I mean, that is the food pantries, that is shelters, that is domestic abuse, whatever it may be. It's all those social services. It's a great service. It started off as Aunt Bertha, and it's evolved and just gotten bigger and bigger in the communities that it serves. But if you need health insurance and you're in that very first spot, Alicia, she's the go-to.
That's awesome.
And the great thing is they're around the state. So especially if your coworkers around the state are working with someone that needs assistance, CKF is everywhere. So
we have a statewide calendar, like not a calendar, but it's a map of the state of Indiana, and it shows all of our coalitions all of our offices plus ours. So I will send that to you.
Great.
And it has the 800 number that you can call them directly if they're not in one of our counties that we serve.
Great.
And Jamie, I agree. Yes, I think it's first asking the question, do you have health insurance? But especially with our Hispanic or Latino population, at first, if it will almost be likely that they don't have health insurance. So definitely making sure, like, where do they need to start first?
Yeah, giving them that direct contact is the best way to start, is what I'm hearing. Yeah.
And also too, if you ever like do come in contact with a member that is an MDY's member or one of the other MCEs, I always like to open it up that you're welcome to reach out to me if you're not sure where to go first or anything to help the member, and I'll definitely help out and assist you where I can as well.
Awesome. Thank you so much. Thank you for attending our workshop today. It was so great just to hear again from each of you and the resources that you have. Each one has a little bit something different, and I heard that, but then also there's just a lot of similarities too. So yeah, if you have any questions, feel free to email me and I can put you in contact with any of these fine people, or you can email them directly as well.